Hello, everyone. My name is Mark Kageyama, and I'd like to welcome everyone here to Be Your Own Hero. I'm a stage 4 prostate bone and lung cancer patient slash survivor. Been dealing with cancer since 2021, doing absolutely fabulous. Hopefully, you've had a chance to take a look at the last video I shot, where I talk about the fires in California because that's something that's very close to my heart because I still consider California to be home, even though I live in Texas now. And we are experiencing some real cold weather for here. But that's good. I'm much rather deal with some cold weather than fires any single day of the year. But hopefully everybody's doing well. Please like, subscribe to the channel, make a comment in the comment section, and let's get rolling with this interview. And I have a very, very special guest. Uh, and this gentleman I consider to be a hero. And that's the name of our channel, to be your own hero. And this gentleman definitely is. And so I'd like to introduce James Kiesewetter at this time. James, please introduce yourself, tell us who you are, and let's get into this great conversation.
Well, thank you so much, Mark. I really appreciate it. It's an honor to be here. I'm humbled by this. Thank you. Um, I'm James Kiesewetter, as you said. I'm a 21-year survivor of stage 3C slash 4, is what they said, rectal cancer. I had a low rectal tumor. Um, Basically, if I could just start my story out a little bit for you, um, I was experiencing some bleeding. Um,
Tell us a little bit about who you are, what you do, and
oh, you want to tell me a little? Okay,
yeah,
I'm a
and then
I'm a
we'll get
coach.
into.
Oh, okay, absolutely. I'm a coach. I coach uh, what's called highly sensitive people. Um, where there's 20% of us are highly sensitive people. We have that trait. We take in more information than the other 80% of the population. It's scientifically proven thing that we have more activity in certain areas of our brain that goes on. Our brains are just wired differently. So some people experience overwhelm and anxiety when they have this trait. So I like to help them in employment. Um, Before my cancer, I was for over a decade, I was in pharmaceutical and surgical sales in the top 10 to 15% nationally. So I was really the top performer for them. And unfortunately, had to step away when I got cancer. So I also help other reps who are having difficulty reaching their goals. And so I coach them through my own coaching business. So between the reps and the HSPs, my schedule is pretty full. I also do some substitute teaching on the side because I love working with the kiddos. So mine are now my two sons are now adults, and I miss them at the younger age. And it's nice to get back into the school sometimes and to be with the younger kids. So that's a little bit about me.
That's great, and raising the next generation of leaders in our country and in the world is such an important thing to do. So, thank you for doing that, and I could tell that
Absolutely.
you enjoy that, and which is great. So, why don't we start with your cancer journey and how it all started and what you were experiencing and what you found, and then we'll find out. You're going to hear why this man is his own hero.
Okay. Well, thank you. Thank you for that hero as well. I appreciate that. As I started to say earlier, I was experiencing rectal bleeding back in the summer of 2003. It had been going on for a number of years. My PCP had told me that it was hemorrhoids and not to worry about it. Nothing to see here, kind of thing. But it started getting a little bit worse. and I just, for some reason, I just had this gnawing in my gut telling me that something was wrong, that I should seek other help. So I self-referred to a gastroenterologist. Um, Went in, I saw him in the summer, or actually it was yeah, in the summer of 2003. Um, and he said the same thing the PCP said, it's probably nothing, James, don't worry. You're a young guy. I was 31 years old at the time, had just turned 31. And he said there was probably a hemorrhoid, but, let's just do a colonoscopy, make sure, just to be safe. Um, so I had to wait a few weeks. That was kind of excruciating waiting because again, I had that feeling something wasn't right. But I did have to wait a
Let me
few
pause you
weeks.
right there. You're bringing
Sure,
up a great point because, and I think this is a great lesson for everyone out there watching. Nobody knows your own body better than you do, right?
great point.
And so if you feel in your gut, like you were talking about, that something's wrong, if the first doctor does not help you or does not give you an answer satisfactory to you, find another doctor, find somebody
Absolutely.
who can get down to the bottom of it because you've lived with your body all your life. The doctor, doesn't have x-ray vision and they can't see, what's going on unless they take the proper x-rays or MRIs or CAT scans or whatever it may be. So go with your gut and advocate for yourself. And this is the first step of why James is a hero. Go ahead, James.
Thank you very much. Thank you. Yeah, absolutely. Advocating for yourself is so important. And trusting your gut is even more important. Um, you know, so I did trust my gut. I ended up going in for that colonoscopy. Um, the nurse again, the pre operation nurse, or a procedure nurse, reassured me. She's like, "Oh, you're so young. There's nothing wrong with you, kind of thing. You'll be fine." And I said, "Okay, I'm excited about getting this done and over with." But I went in. Excuse me, just getting over a cold. Sorry about that. Um, so I went in for the procedure. Um, I woke up after the procedure was done, but before they brought me back into the post-op area. And I had worked, as I said, in surgical sales and pharmaceutical sales, and I had been in OR and procedure rooms enough to see enough of the images to know what a healthy colon looked like and what a colon with a tumor looked like. And looking right at the screen, I was positioned on the bed, and my doctor was consulting with another doctor. They were pointing on the screen and stuff. And I woke up and I just said, oh, doc, where are we looking? Where are we looking at here? And he reassured me. He said, we'll talk about it all later. We'll talk about it all later. It's okay. And he made the anesthesiologist put me back to sleep. So I went back to sleep. I woke up an hour later in post procedure, and I immediately asked the same nurse, for my chart, and she got a concerned look on her face, and she said, "Why is everything okay?" And I said, "No, I have cancer." And she just burst out crying. She it was something it was unexpected. I certainly didn't expect it. I should be the one crying, kind of thing. Like, this is what I'm going through. I thought that some of these nurses would be stronger, and stuff, but it just goes to show you we're all human, you know. And we had developed this rapport in pre-surgery or pre-operation, whatever, the pre-procedure room and stuff, and then to the post. And she was so sure that everything would be fine. And literally, she burst out crying in tears. And I found myself consoling her for, 10 minutes afterwards. It's okay. Everything will be okay. And it was
Wow.
just, it was wild. It's like, thinking about it later on, I was like, well, I should have been the one, feeling that and going through that and being consoled by the nurse, or by somebody, Um, but I just, I kind of just went into my surgical sales mode kind of thing, and just, there's a problem, let's attack it. Let's figure out what's wrong and let's get this done with, kind of thing. So, in any event, she got me the chart. I was able to look at it, and I was able to determine that I had a very, very low rectal tumor. And he came in, about a half an hour later and talked with me directly. And by then, we had already put a call into a colorectal surgeon that I knew very well, and who I had been in on, procedures with in the operating room and stuff. And he's the one that I ended up going with for my surgery. So um, I went through a bunch of tests. It was uh, it was kind of hard for the first couple of days afterwards, because I had a big assignment at work that I was working on, um, and I was supposed to call the surgeon, the next day to schedule a time with them, because it was the end of the day, and they were wrapping up, and he didn't have his schedule available to see me. And so I was supposed to call him the next day, and the next day went by. I didn't call him. And then the day after, I got a call from him on my cell phone. I was busy with work. I was planning to give a call in a day or two, thinking no big deal. It's all right. So I have cancer, but we'll deal with it. Um, and what's a day or two going to do? But he explained to me, he's like, James, this is really serious, and you need to treat work as your third priority, your family as your second priority, and your health as your first priority. And get in here. So he scheduled a whole bunch of tests. I went in for um, different ultrasound tests, internal ultrasounds, um, uh, you know, um, CAT scans, MRIs, PET scans, and they determined that ultimately it was uh, at least stage three rectal cancer. I was later upgraded to stage 3C/4 rectal cancer, because they found a spot on my liver as well. But uh, that was later on. I went through
Let me
chemoradiation
pause you
initially.
right there, James.
Sure.
So at that point, you got your diagnosis.
Yep.
So what's going through your mind as far as the cancer goes?
Yeah. At first, Mark, I'll tell you, I kind of pushed it out of my head initially to deal with the work assignment, but ultimately I got yelled at for it, you know, and I should
Yelled
have,
at by who?
by the surgeon, who
Oh,
called me
okay.
that next day, and saying that, you need to get in sooner, kind of thing. Um, and he had every right to tell me that. I thank him for telling me that. Um, I had a lot going on, and you know, I needed that redirection. So to go back into that mode again, that okay, it's time to concentrate on yourself, James. On your body. There's something wrong with you. Never mind everyone else that you help and you take care of. And I've always been a people person, a fixer kind of thing. Um, and it's time to focus on yourself and to care for yourself. So that's what was going through my head. Initially that denial, and then that acceptance that okay, this is really serious. I need to focus on myself and get in there. So I did get in there, like we said. And go ahead, you had a
So
question.
what was your, okay, so you're starting to focus on what you needed to do for your cancer. What about your family?
For my family, it was difficult. I was married at the time. We were young. We married when we were young. Um, my wife and I had been going through some difficulties. Um, so it was really tough on her. Um, she had a rough time with it. We had two young sons at the time. They were 3 and 5, or 3 and 6. Um, and it was a lot. It was a lot to deal with. Um, and my I had my mom for support, and I had other siblings, my sister and my brother. Um, they didn't, they weren't as helpful, but my mom really was helpful for me, and helped to guide me, and direct me through a lot of this stuff. Um, as I said, my wife and I had some issues, um, and so it was hard for to lean on her for support. I was used to being in a caretaking role, helping her manage her type 1 diabetes, and she had been a survivor of sexual assault as well. And so she had some difficulties on dealing with traumatizing news and stuff. And so yeah, it was difficult for her to do the role reversal, and for me to no longer be the caretaker, and me to need somebody to be the caretaker of me, you know. Um, so um, that's basically the support that I had. Initially, I went online. Back in 2003, we didn't have all the different support groups that we do now. Luckily, thankfully, we have programs like yours and others, um, that support patients who are going through cancer. There's cancer coaches now, which didn't exist back then too, and can help you through it, your diagnosis, and through the treatments, right through to recovery. But at the time, all we had was these different chat groups. So I would frequent the chat groups, and I was known as Cancer Dad on the chat group. And I ended up, helping out a lot of other people and stuff too. But they helped me just as much, providing me feedback and information about, um, what I can do, and to try to seek treatment. And that went on for a number of years. I participated in those groups. It became very difficult when I started losing a lot of really good friends, that I had developed, uh, to even lesser stage colorectal cancer, you know, and that was really tough for me. So you know, I was like I said, I was Cancer Dad, and I helped out these people after I had gone through my journey, which I'll continue telling you in a minute. Um, but you know, um, it was just yeah, it was tough to lose these friend after friend, um, to this horrible disease. So if I can, I'll continue telling you my story now,
Oh yeah,
if that's
absolutely.
okay.
I mean, and I completely resonate with what you're saying. Um, you did something back then, because I've talked to a number of longtime survivors, and you're the first person that I've talked to that actually did get involved with chat groups. Everybody else back then, I know one guy, he's been like a 30-year survivor, and he didn't have anybody to talk to, and it was really an isolating thing. So you did
Right.
a very, very smart thing to, connect yourself, because we all need to be able to share what we're going through, because, family and friends, they just don't understand. It takes somebody who's actually going through what you're going through to understand, and really,
Absolutely.
resonate with your situation. And it's hard. And I don't blame, the people that are around us or, dealing with it. It's just, if you don't have it, you just don't know.
That's exactly it, right? And they have their own things that are pulling at them too. And caregivers are, I give them a lot of credit because they go through a lot. Um, Sometimes I think even more than we the patients do, you know, um, in helping to take care of us and everything else that's around them, to manage that. So I give them a lot of credit, but well said point. Um,
Yeah, absolutely. And you're spot on with everything that you just said. Uh, the most compelling interviews that I've really done are with family members or close friends of people who've gone through cancer that they've lost. And one of the best interviews that I've done is with and you know her, Carol Honorado. And
yes,
I mean, that particular interview, Kara, if you haven't seen the interview, I would highly suggest doing so. It's on my channel, To Be Your Own Hero. But she lost her 19-year-old daughter to cancer.
right,
And that interview was the most difficult interview I've ever done by far. It far and away the toughest. I don't even know how I got through that interview because it was just so emotional. And it's hard. It's hard. And like you just said, it could be even be harder on the other people because there's such a feeling of helplessness
right,
and not being able to be in any kind of control. You're just somebody there and you're trying to do your best and it's a feeling of just helplessness.
absolutely. That's
Yes.
a very good point. Um, yeah, um, well said. I'll leave it at
What
that.
I want to do, James, is I'd like to ask you back to do a part two because I know we're going to be running short of time. So let's keep, if you'd like to do that, I'd love to have you back. So, because you have like a great story to tell, and we haven't even got into the meat of it really.
No, we
Um,
haven't. It's been a long journey, long battle,
Oh,
right?
yes. And you have so much knowledge and so much, that our listeners could learn from. And that's the beauty of, talking to people and hearing directly from experience. And, when I started on my cancer journey, I wanted to hear directly from the patients and survivors that had been through it because nothing replaces direct experience. Nothing replaces that. And to hear,
Absolutely.
I did not want to hear from salespeople or doctors or people that were just, like dealing it from the outside. I wanted to hear people that actually went through it. And so, what you're sharing is absolutely invaluable. So let's continue on in your journey.
Excellent. Yeah, and I would be happy to come back, Mark. Thank you. Thank you for the invite.
Thank you.
Um, yeah. Um, so I found out I had stage three cancer at least. Again, it was later upgraded to stage 3C/4 with that spot on my liver that they were concerned about. And um, I immediately went in. Well, after getting all the scans, PET scans and the CAT scans and the probes and the ultrasounds, internal ultrasounds and stuff. I went in to get my portacath installed, um, and I still have that scar. That still tweaks every once in a while now, even though they removed it for me. I get those tweaks of pain every once in a while that remind me, oh, that's right, I did have that. But the portacath made things easier for getting that chemotherapy. It ran a line directly over to my jugular, down my jugular vein, and fed right into my heart, top of your heart. So that way they can plug you in and give you chemotherapy that way. So I was booked for that. I had that surgery first. Then right after that, I was scheduled to start the chemoradiation therapy. They tattooed me. I have tattoos on my hips and my pelvis, where they can use it for alignment to zap the tumor. They wanted to try to get a more accurate zap, even though it was a wider beam radiation at the time, and still affects my hips to this day. I've got premature arthritis in them, and whatnot 20 years later. Um, but yeah, I went through chemo radiation. I received 5FU at home. It's called 5FU is the name of the medication. It's a steadfast medication that they use for colorectal cancer. It's one of the oldies, but it has side effects. Of course, all these chemotherapy agents have side effects. And you know, I I also had oxaliplatin, which I would go in to receive in the hospital in their IV suite. Um, and again, went through this for 2 or 3 months worth of that, along with going every day for radiation, um, where I would go in and they would put me down on a table and you know make sure that I was in the right spot and do that wide beam radiation on me. Um, that did help to shrink the tumor down, luckily. Um, but I was still in for a number of surgeries and then more chemotherapy at the end. um, so my first major surgery, they did what's called a coloino pull through. It's kind of a last resort surgery because unfortunately, male pelvises are much more narrow than female pelvises. You'll notice a lot of females who have colorectal cancer. They don't end up with permanent colostomies like I ended up with, which I'll tell you about in a minute. But you know, it's because of the narrow pelvis, and it's just so difficult to get down that low in the pelvis for the surgeon to do that surgery and to cut off and make sure that they get all of the cancer with good margins on either side. Um, so for me, it was a long surgery. It was supposed to be 8 hours, but it ended up being 10 and a half hour surgery. Um, and I woke up. I felt like I was hit by a bus. I I I can't even describe to you, how weak I felt. Um, it was horrible. I was in the hospital for about a week or so. I wanted to get the heck out of there, but I still had my indwelling catheter. They finally pulled the indwelling catheter and um, and gave me a time limit. Okay, so you need to pee within five hours, or else we're gonna have to re-stick you. The nurse said, um, and so she was a pleasurable woman to work with. um, Certain nurses are not that pleasant. I'm saying that facetiously. So um, yeah, she wasn't the best nurse to work with. Um, but you know, they removed the catheter, and I had the 5 hours. And as the time ticked by, I I got more and more anxious that, oh my God, why can't I pee? Why, this is just, it's not working. Nothing is working. And I was just, uh, I ended up bawling to the doctor later that morning because I went in for surgery for, on my rectum, and knew that I would end up with a temporary ileostomy where they connect the small intestine to an outside bag on your body, usually on the right hand side of your abdomen. Um, and that completely bypasses the large intestine and allows waste to get out. So I had one of those that was supposed to be temporary. We ended up reversing it, a few months later. But after months of trying to make things work, about 6 months trying to make things work again, um, it we found out that the stricture in my rectum was so great, that the scar tissue was so great that it was impeding on allowing feces to go through. So I ended up with a permanent colostomy. I chose to go and do a permanent colostomy, um, and went back in again for major surgery to have that done. Um, and after all that was said and done, and I had my permanent colostomy, and I finally healed, which was really difficult because I had had all that radiation, and the healing part took forever. I ended up with suture pus pockets and nasty things that I won't even get into with you guys, but these fluids that just come out of the incisions, as the incisions break open and all that. Um, it was it was an experience, I'll say that. Um,
Let me
so I
pause you right there, James.
Sure.
I have two final questions for you,
Yeah,
and then we're gonna uh, cut this part one short here. The first question is, looking back, would you change anything that you did? Knowing what you know now.
that's a great question, Mark. Um, and the first, I don't know that I would change anything because I relied on the surgeon for their expertise. And I had consulted with Memorial Sloan Kettering as well, and ultimately decided to stay local with my local colorectal surgeon. Um, but the stapling devices that they use for low anterior resections, um, they used a different brand than one of the staplers that I actually sold, believe it or not, in the OR. And we had come out recently with a slimmer model designed for male pelvises. Um, and I said to myself, I wasn't going to push that on the surgeon. I wasn't going to, I was going to let him be comfortable and do what he wanted to do. And so he chose to use the equipment that they had in the hospital instead. And looking back, I wish that we were able to try using the smaller stapling device, because had we been able to use the more narrow stapler, it probably would have fit in the pelvis, and I would have ended up with a much easier um, low anterior resection, they call it, using stapling devices, as opposed to the 10.5 hour coloanal pull through surgery. So yeah, that's one thing that that's gnawed at me, years later, that I've thought about, um, that I would have liked to do differently. Otherwise, no. I had the support that I felt that I needed at the time. Um, if if I knew that there were cancer coaches, or like there are today, I would have a cancer coach, from day one, definitely. Um, that's something that I would do. But given the time period when I was diagnosed, there's nothing else really that I could have changed.
Hmm.
But I did find out, what this did for me, not to me, which was a big, aha moment, which we could discuss in the second version of this, if you
Okay.
if you
I have
I'm
one
good with
final
that.
question for you,
Sure.
and it's totally different than what we're talking about here.
Absolutely. Shoot.
Our world is is troubled, needless to say. How would you help make the world a better place?
How would I help make the world a better place? I think that kindness is something that costs us nothing, but it means the world to the person that you're giving it to, and it means the world to you as well. You don't know it, but it does. It has a healing effect for the person who's giving as well. So I think that if we had more kindness in this world, then this world would be a much different place.
What a fantastic answer. James, thank you so much for sharing your journey, and we're going to bring you back for part two. And I'd like to thank everyone out there who's joining us here at To Be Your Own Hero. Please like, subscribe, make a comment in the comment section, ring the notification bell, and just remember,
The thumbs up.
absolutely, just remember that we all go around one time. And James and I have stared our own mortality right in the face. Every day is a gift, and that's why they call it the present. So make the most out of each and every day, each and every hour, each and every minute, and each and every second. And you'll be so much happier that way because when you realize that, you know, today or tomorrow the future is not given to you. Make the most out of each and every second that you have. And with that, thank you so much for joining us here at To Be Your Own Hero. And we will see you next week with part two with James Kiesewetter and sharing the rest of his story. Thank you so much. Bye bye.
Thank you.